My name is Sam Ditzel. I own the Austin Longevity Clinic. And what I want to do with this talk is deal with the subject of longevity, which has become very popular now. We've all read Peter Attia's book. Everybody's gone through Outlive, seen the podcast, but a lot of us don't know where to start and how to approach longevity practically for us because it's such a big topic. And there's a lot that we see on social media that differs from what we need to do practically. So, what I want to do with the talk is differentiate between what has a lot of sex appeal and longevity that we see on social media or in the podcasts, and the practical, approachable, day to day habit side that we really need to focus on. Because if one of my clients wants to hire a $50,000 a year private concierge doctor and do cold plunging and biohacking and inject a lot of drugs and take 40 supplements a day, that's fine. If they have the money and the time, they can go for it. But that's not accessible to everybody. So the majority of clients really need practical day-to-day lifestyle choices. Those are free, those are accessible. They might take a little discipline and maybe you need a little guidance in the beginning, but everybody has access to that. So you don't need 3 hours a day and you don't need a private doctor and you don't need to do blood work every month. So that's really what my talk deals with. The second differentiation is really between what we need over the age of 40 versus under the age of 40. And those are two very different things, especially when it comes to how we train our bodies, how we eat, how we deal with our sleep and stress management. Those are all practical approaches that, again, don't cost any money and are way more accessible to the majority of people. That's what we do in my practice as longevity coaches, is help people find that path. So that's a lot of what I want to talk about today. The final piece of this talk is designating what we need over the age of 40 as men versus women. So the majority of the data we have on wellness, nutrition, certainly physical training, was gathered on 20 to 22-year-old male athletes when they were in college. That data doesn't really apply to a 45 or 50-year-old female. And since they need very different things, if I apply that type of training modality to a female athlete over the age of 45, she's not going to have a good outcome. If I apply that data to a 45-year-old male athlete, he's not going to have a good outcome. So since we need such different things, that's an important part of my topic as well.